Present AJ News.
99.1 WPLR, 95.9 The Fox. So, what's it like in the hospital at the Connecticut hospitals?
What's going on?
Is it slowing down? Is it getting better?
Right.
Dr. Fred Browne, Chief Medical Officer at Griffin Health, on the phone. Are things getting better, Doc?
Yes, actually things are getting better, and at least we're getting a little bit more control. I mean, we're still getting, every once in a while we are getting patients that come in that are COVID positive, but we've definitely met our peak, and it's actually passed. So
right.
That's good.
Cool.
What
was it like during the peak? How crazy was that?
It was pretty crazy. It was really crazy. ICU was full. Lots of different areas, and unfortunately, when people end up getting COVID-19, they get really sick and they stay in the hospital for an extended period of time. But I think I got to say, and I got to say, Griffin Hospital really stepped up. We made a lot of changes prior to the event. We have a lot of different areas that were focused on the COVID-19 and how to manage these patients, and I think we really followed through, and it worked out well. I mean, as well as it could given the situation.
Right. It had to be tough for you to watch your staff go through this. I mean, some of them are, holding a laptop or an iPad or whatever so a loved one can communicate with a family member that was dying.
Sad.
And so you have that. So the hospital's overwhelmed. The staff is getting worn down. The news out of New York was getting worse by the day. That had to be brutal for everyone there. Right?
Absolutely. And you can imagine that. I mean, I can't say that we didn't have any mortalities. I mean, everyone did. But yes, it's really difficult because you have to be really careful about, making sure the staff is safe as well as visitors of the family. So yeah, it was really tough, and we were able to, at least have some FaceTime or at least have some digital communication between family. But it became very traumatic, and again, making different areas of the hospital basically dirty units. So, trying to limit the amount of people that were going in so we can reduce the amount of spread or potential spread throughout the hospital, which, again, I think we did really well. We really can't say that we had a lot of spread, or if any, within the hospital.
Dr. Browne, Chief Medical Officer at Griffin Health, on the phone. So now, Wednesday, we begin to reopen the state, and as we start making more contact, we talked to the governor last week, and he expects, and I think we all do expect, a rise in cases because it's just mathematically going to happen.
Definitely, yeah.
Are we ready for another wave? Are we better prepared for another wave?
I would say yes. And I think there's two things. One is that I think the big wave is over, so that's I think a really good thing. The working group that is going out can get infected, but again, don't get as sick as the vulnerable population, the elderly, the immunocompromised. So we're at least we're expecting that. As for within the hospital, we're not really changing our units. We're not changing our processes. So what we want to do is we want to optimize the safety of our patients. So if a patient comes in and does have symptoms consistent with COVID-19, we have a special unit in the emergency department. We have a special unit on the floors to keep those patients sort of well cared for in an area, because we still need to manage the patients who have not been getting care for the last 4 to 6 weeks,
right,
which is starting to become a really big issue.
And I'll get to that in a second, but I know that now we're better set up for the process. When you walk in the door, the testing was a big one.
Yeah.
We were saying, because there was no tests. So it was, you're not getting tested unless you're having trouble breathing.
Yeah.
And
now we have all these rapid tests and whatnot. So all of that has to be great, right? Or better.
It's better. It's much better. Knowing if someone has it or does not have it makes things a lot easier to know where we can put them, making sure that if a person has the infection, we don't have to rule them out to see if they actually have it. What we can do is we can put them into the appropriate unit right away.
Well, we had a 57-year-old friend die. He went to the hospital, not Griffin, went to the hospital on Thursday. They said, you have bronchitis. He came back on Saturday. They said, you have pneumonia. And by the way, while you're here, we'll test you for COVID. He had COVID, and then he went on oxygen, and he got off oxygen for like a day. Then he went back on, then onto the vent, then didn't make it.
Yeah.
And I think now if you walk into a hospital with any signs, they're gonna give you the test and they're gonna identify it much earlier.
Yeah.
So what about all these other people who have not been going to the ER or not been going to a hospital to get stuff done? That could be just like the unspoken wave, right?
Absolutely. And it's been devastating. I mean, there's been some people who've come in. I mean, people have been so afraid of coming into the hospital and getting exposed to COVID-19. They've been so afraid that they've not come in after having heart attacks. And you can imagine that if you have a heart attack, I mean, you have this chest pain and you're just so afraid to come in, that does some serious damage to your heart. You end up having heart muscle that can get damaged, and then there's, if you survive it, then there's all these complications associated with it. As well as people who come in, we've had people come in with abdominal pain, have had abdominal pain for a week, just couldn't bear it anymore coming in, and they have a ruptured gallbladder, which we hardly ever see. Appendicitis. So it's really important that people, this is one of those aspects of disease worse than the cure kind of thing, or
your leg fell off.
It's funny you
right?
should mention that. I know two people who were in tremendous pain, did not want to go to the hospital, and then eventually went. Wow. So,
and we're here to say that the hospital's actually been. I mean, the whole preparation for COVID-19 is also very helpful in the aspect of managing it after the wave. So by having clean units and dirty units, having testing, patients are safe to come. So I think that's the big, that's the big message out there is that, if you're sick, you have to come to the hospital or you need to go to your doctors. We're taking proper precautions. We're screening. We're testing. You're safe to come back to the hospital.
What about the false negatives for the test? Is that concerning? That worries me a little bit.
A lot of the false negatives are usually associated with people who don't have symptoms. So if you don't have symptoms, then you can potentially have a likelihood of false negatives, and you can sometimes get false positives. So that's important to know. If you have symptoms, we will test, and then if there's a concern that it's still there, then we can retest. But it is always a concern, and there's different algorithms to make sure that we can test in different ways to make sure that we can overcome those false negatives and false positives.
I like that you have a dirty unit.
Right.
So
Be calling for a band.
Right.
Dirty unit.
That's
and the false
name.
negatives.
Yeah, and I know, again, it's sort of a technical term, but again, having an area that is COVID-19 or again, make sure that everybody is wearing proper precautions, high level of PPE, and making sure that that's clear. So again, I think that's...
Well, that's what people want, too.
Exactly,
when you're going to the hospital for something that's unrelated, you want to know that everyone with
Clean
COVID
unit.
is over somewhere.
Way there.
Like
dirty
CDC level stuff with, new gowns, new masks, all of that stuff.
Air sealed, the whole
they're
9 yards.
over there,
Right.
And you're over here.
Right, for my busted toe,
Very good. All right, we're going to link up to griffinhealth.org at WPLR.com and 959thefox.com. Dr. Fred Browne, Chief Medical Officer at Griffin. Thank you very much. I was born at Griffin Hospital, by the way.
Oh, you were?
See?
That's fantastic.
I don't want anyone to hold that against Griffin.
No, still go anyway.
Don't listen to me.
Remember that.
Despite that, they're good.
All right, thank you, Doc. Thanks for everything and your entire staff.
Yes, thank you.
By the way.
And thank you guys for getting the word out.
Did you guys see the flyover?
We did. Very neat.
Cool. That
Very
wasn't
neat.
something very special.
It was.
Yeah, all right.
We ordered that. Just kidding.
Well, thanks, guys. Appreciate that.
You got it. Dr. Fred.